Okay, let's see. Huh?
Okay.
Hey, okay. Hope that people can hear you all the way down till the end.
I try not to touch the screen today.
Okay. I'm adjusting. Try to adjust the screen so that everyone can see my colon. Yeah, not so high, but yeah. Maybe I stand further back.
Yeah.
Stand further back. Yeah. Okay. Can hear all the way. Yeah, who can hear all the way? Sure. So. If not, I'll cut you out. No lah. Very difficult to edit the sound in.
No problem.
Your line, probably your line is, huh?
No, I don't think with my line. I think yesterday I was touching something, and then I think I accidentally pressed on something.
Oh, hi Cheng.
Hi Cheng. Yeah, so today I don't think I'm gonna touch the. I'm not gonna touch.
Okay. In fact, we haven't posted the previous two video in you posted, right? They can.
I haven't really posted on the Instagram. What do you call this? Instagram, IGTV. Okay, because I'm still working on it and trying to see how do I post it online.
Yeah. Okay. So we try to have more interactions with our friends. If you know.
Yeah.
Hope that you can type whatever that you want to know. So of course, we may not be able to answer your questions right now, right here, but we'll be able to go back, find it, or maybe ask our instructor. I saw Eric Marlin was in my FB live just now. I don't think he can understand any Mandarin. Eric Marlin, yeah, our instructor. Yes.
Ask him follow on Instagram.
I did invite him to the Instagram. If he's here, I don't know. I don't know whether Eric will come in on the Instagram or not. Then you can share. We can invite him to the talk one day.
True.
He's starting some polyvagal class online in Europe. So he updated me. Maybe we can do some online course with Brown in the coming months, and see how is the arrangement. Now, hopefully we can continue with the Eric Marlian's polyvagal class. It's about the vagus nerve. I guess we can start now. We don't want to delay anymore. Like Joshua. Okay, hi Joshua. All right, we'll start with colon's anatomy. Simple one. We are not going to detail. Just see this colon. This is the cecum with the appendix. All right, ascending colon, transverse colon, descending colon, sigmoid, rectum. All right, this is rectum. So we are concerned with rectum. We'll leave it till the last day when we are talking about the pelvis organ, like the uterus and bladder. Okay, together with the rectum. So we will talk about the whole stretch of the colon. Let's see these three ligaments. Yeah. So look, as many other organs in our abdomen, it has to be attached to the frame, right? To keep it in place. So in the colon, right colon, we have left and right. We have the pharyngocholic ligament that attach the colon to our diaphragm. All right, the diaphragm. So after that, you have this ligament that attach the colon. We call it hepatic flexures to the liver. Okay, this is my right side. Maybe in the screen is left side. All right, this is my right side. And then this colic ligament to the gallbladder. So on the left side, we have the ligament attached to the spleen, attached to the pancreas. All right. Other than this ligament, we have mesocolon, transverse mesocolon here that attach this portion of the colon to the pancreas body. So the pancreas body, how the pancreas body are covered by this membrane. All right, we call it fascia. So another thing, small. See, I go backward. Okay, I go backward. So we have a sigmoid, another mesocolon, sigmoid. Colon. So when there is a colon, means this portion of the colon will be able to AC and DC. AC and DC stay here in place. Can create two portion. What PA say? Without the guiding, all right, we won't be able to function properly, like fecal stations, like the process of passing motions, right? When it's full, the sigmoid has to glide up, right? It has to fold up and down. Same here, when the transverse colon, when our body are empty, when we are not eating, the positions of transverse colon can be as low as this. So everyone has a very different positions of the colon. So it can be very, very twisted. Even for the cecum, many people have different kind of positions for the cecum. So for the distal manipulation therapist, you have to learn how to palpate the cecum properly. Well, it's not always here. Some people may be down here. So the variance of the colon is very big. Yeah. So when you are full, the colon will come up more. Transverse colon will come up more. So go down, come up. So we are talking more on the big colon, but don't forget we have a small intestine. Small intestine attached to the cecum through the ICV valve. So spasm in the small intestine can also cause restriction in the colon. All right. So yeah, that is the mechanical of it. Colon is my favorite organs in my clinic setting because I see a lot of people who has colon dysfunctions, particularly in the I think Asian is more. Western is less. I don't know why, but I think it has to do with some of the emotional part. Yeah, we'll talk about the emotional later. So yeah, okay now. So other than the diaphragm, our colon has many neighbor organs. Like for the right side, okay, right side, the cecum are attached to 60% of the female will have this clay ligament attached to the right ovary. All right. So on the right side, they have attachment to the liver, to the gallbladder, to the diaphragm, and behind it is the kidney. All right. And besides this is the duodenum. So there's a lot of structure that can affect the functions of the colon. On the left side, we have spleen, we have the pancreas, we have the left kidney. All right. And what else? We have the DJ junctions. All right. We have the stomach. Okay. These are the structure that can affect the colon as well. So let Alvin help us with the symptom when you have the colon dysfunction.
Okay, so when you guys have when we have this dysfunction of the colon, so like, okay, so what I'm gonna do is we divide into two. Okay, the sigmoid and the cecum. Okay, so normally the cecum the presentation of the cecum, normally we have this right knee pain. Okay, because the cecum is actually on the right side, so it may actually having pain translating down to your right knee. So sometimes you may have right knee pain, and there's a unknown cause of it. Okay, because of this and because of the nerve that is compressing, that is this obturator nerve that we are talking about. Okay, and if let's say you look at it, of course, sciatic nerve, which is our largest nerve, okay, at the lower limbs. So you have this right sciatic pain as well. So besides from the one that we were talking about, like the liver, you know, the kidney can cause this sciatic pain. Actually, the cecum actually can also cause this sciatic pain as well. Besides that, lower back pain is also another symptoms that you guys can actually take note. Okay, and then normally the muscle that they attack, okay, is a QL muscle, quadratus lumborum, or we call it. So if let's say you guys have this presentation, you know, so there are, you can actually think about like what we have discussed previous days, okay? And then, so now you can see you have a clearer picture, I hope, that, oh, besides, why are we having this unknown pain, okay, that we go to see therapy and be treating so many times maybe, okay, but the problem is still not solving, okay, because besides from the musculoskeletal structures, okay, like the muscles, okay, like quadratus lumborum, erector spinalis, okay, if let's say we talk about cecum, it can also cause your QL become tender and become tense as well. So you must also have this abdominal tenderness because of the structure is there. And that one, another thing that is also this when you do this breathing, especially exhalation, okay, you may also, how to say, you may feel a bit discomfort or uncomfortable because of the tension or the spasm of the cecum or the colon that we are talking about. It's actually pulling down on the diaphragm. So that's why when you try to breathe out, you tend to have this discomfort kind of feeling. So you don't like to, you know, yeah.
When you are breathing in, right, in fact, the diaphragm push it down. So in the shortening position, you won't irritate the nerve. When you breathe out, the diaphragm will pull up the colon, and this will irritate the spasm colon.
Yes, because they always like to get into a shortening position rather than a lengthening position. So that is why you always have this kind of discomfort when you're actually breathing out. Okay, and when we talk about the left side, that means the sigmoid, okay, same thing. Also, you have this left knee pain instead, and also left lower back pain.
Sciatic pain.
Basically it's the same with the right side.
It's the same.
You know, it's actually the
but
same.
more or less a different mechanism. Like Jean-Pierre Barral always said that the left side is more to do with the venous flow, and the fascia tensions. It's less, but then it's more on the right side. It's more to do with the increased tension in the ileocecal valve, the mesentery roots from the small intestine. So it's a different mechanism. The treatment will be slightly different.
Yep, that's true.
But
and also I think the left side, the sigmoid, will also cause this constipations and this diarrhea as well because of the absorption. So the colon is actually work as a how to say, for the absorptions of the nutrients, okay. If let's say actually malnutrition, okay, then it will cause the absorptions to become how to say, lesser. So you may have poorer. So that's why you have this diarrhea, constipation when you go to your toilet. And for the right side, where because like just now Evelyn was saying that because of the ligament, 60% of the women, okay, especially adults, during their puberty time, they may actually experience maybe like menstruations, menstrual cramps, okay, menstrual cramp because of the ligaments itself is being pulled, right?
Pulling on the
so
it depends
so these are the some.
You can continue.
I mean also is another thing that one of my patients is also having this is the IBS, irritable bowel syndrome, that we can actually, you know, we need to take note as well.
I think my friends in JB, she had one client who has a leaky gut, right? He was having a lot of bleeding in his bowel, fresh bleeding. So after the colon manipulations, you know, 1 or 2 sessions later, he has a really, really tremendous improvement. So no more bleeding. And that is how, it's some of it we share cases with each other, and it's really interesting. So in my clinic, I see a lot of female with these colon issues, which leads to a lot of knee pain. So a lot of them are in fact almost scheduled for the TKR. Right, almost scheduled TKR. Then they come to seek second opinion and do some alternative treatment before they go for operations. And there are many of them who change the plan, so still functioning very well without TKR. So there's a lot of times when we find that the restriction in the cecum and the restriction in the sigmoid that can irritate the nerve, and irritate the nerve so badly they can't walk, or the joint has changed, because if it's too chronic, it might become actual arthritis in the end.
I mean, just for those who are not from medical field, what does the TKR means is a total knee replacement. Yeah,
okay.
I mean,
Totally,
for those who are, how to say, they
yes. Yes.
then what's the terms, what is TKR, you know.
Right. Okay, and other than the symptom that you mentioned just now, not sure here. I think we will ask some friends here. You know what kind of pain that you have experienced. You know, like do you after all this series of the talk, okay, what are you more concerned? Do you have chronic pain, chronic back pain? Maybe you can drop us a note here. You know, like then we know what kind of topic that we want to elaborate more on your pain or help you with the knowledge. So other than the lower comment here, yeah, and other than the lower leg, lower back pain, knee pain, in fact, any organs that's attached to the diaphragm, right, be it liver, stomach, spleen, or colon, they will have more or less indirectly affect the shoulder joints. Right? So if the spasm comes from the cecum, it pulls this ligament down and it will affect the diaphragm. So it will affect the tone in the diaphragm if the problem starts from the cecum. So the diaphragm cannot glide properly. You may have experienced some breathing difficulty, okay? And eventually it might lead to the shoulder pain. On the right side, the cecum will be more on the right shoulder. If you happen to have restriction in the sigmoid that pull down the colon, which pull down the left diaphragm, and then you may experience the left shoulder pain or neck pain. Yeah, it depends on where is the restrictions and what is the structure that was affected.
Yeah, that's true. I mean, when there's a pulling of the organs, so it may actually affect your posture as well. You know, you become more hunched or what do you call it? Hunch positions or rounded.
Side bending positions. Side bending. If left side is tight, you want to bend the left side. Right side, you want to bend the right side. And a lot of people, it's like vicious cycle thing. So sometimes it's because of poor posture that lead to poor gliding of the organs, and then cause adhesions, and then a vicious cycle that's kickstart. So it become regular. It's become, posture become a habit, and it leads to restriction and enhance the problem. So other than all this posture, maybe the mechanical trauma to it, any trauma to the diaphragm, any lung issues can cause the diaphragm to become tight and also affect the joint here, the flexures here, that further affect the mobility of the whole colon, and also the chronic inflammation that we might experience, because we have our body have a lot of micro inflammation that we are not aware of. So all these small inflammations that happens in the intestine will create some scar, will create some adhesions in the fascia. So eventually it's a build up, the problem will become a big issue if the fascia become too tight and restrict the organs. So chronic inflammation,
accumulations of scarring, trauma or injuries, so it doesn't show, it doesn't show up at the moment that you hit it. It's not like when you get a what do you call it, like an accident, boom, and then you can fracture or a bruise. Okay, sometimes even like for bruises, okay, we may knock ourselves on the table today, maybe 3 days later only you're seeing the bruise. Okay, so sometimes it doesn't show up immediately. It may take some time. I have clients that having this pain, neck pain. Okay, so it's actually more on the her working habits. Okay, after asking so many questions with her, so it's actually the monitor is actually on one side. Okay, it's not on directly face in front. Okay, so this is actually about posture. Okay, so 24/7, 8 hours a day is actually on the right side and the keyboard is in front, but she have to keep turning on one side. Okay, so you guys have to know that sometimes because of all these accumulations, 8 hours of doing the same movement, it can actually cause us issue. Okay, it's not just that, because I'm turning this way and I do something and then it comes. Okay, because my client actually complained after her workout, then she say, I'm having some neck pain because after the workout. So I thought it's maybe coming from the workout, and then she got injured. But after further, how to say, like questioning, assessment, you know, oh, it's actually coming from her working habits. So
yes.
so the therapist will
The
always
workout
try
just
to
trigger
ask you,
the pain.
yes,
Yes,
find
yes.
out where is
Workout just yeah.
causing. Yeah.
So we also have to touch touch a bit on the abdominal surgery. Okay, any surgery in the abdomen can cause scarring. So all the scar can pull. So the pull effect on the colon can change the dynamic of the structures. Yeah. And okay, and intestinal process. I always talk about intestinal process. It happens regularly. The small intestine will process into the space if you are female having a hysterectomy or the retrograde uterus. Okay, so when the small intestine drop down in the pelvis or region, it will cause a ring type of pain around this region, like T12 to L1. Yeah, so a ring type, because this is where the roots of mesentery of this small intestine are being dragged and stretched. Same with the transverse colon. So when the small intestine drop, it will also pull down on the transverse colon. So this is some of the mechanical thing that we can talk about. And long hours of sitting, like what you say, long hours sitting, bending forward, you are like crushing your sigmoid and cecum to the hip joint.
Yep.
And they will also become so stuck and glued together.
Yeah.
Mm.
So that's why it's how to say, you always feel like you want to hunch forward instead of like sitting upright.
Yeah,
So,
it's more comfortable hunching.
Yes, because of all this adhesion, so it's it may be, how to say, like for me, because I also teach exercises to my patients, but sometimes it's just very hard for them to keep themselves upright, because they always ask, oh, should I stand up tall, all the time, but no, because even if you are forcing the body to do something that is uncomfortable, okay, so we don't force our body to do something that is unusual for the body. We need to, how to say, take some time for the body to relax and to adapt to that kind of changes that we are doing or teaching the body, because we are trying to calm down the system. And then slowly, when the colon is more relaxed, okay, like just now we were talking about, when breathing out, the colon is actually in a shortening state, and then it stretches because they don't like it, so it causes you some irritation. Okay.
Nociceptors, yes.
Yes, because of the nociceptor, of course. So
yes.
we don't force it. Yeah.
And also, when we're talking a lot of mechanical dysfunctions in the colon that leads to pain, right? In fact, in terms of physiology, when the colon lose the function, they lose the ability to absorb electrolytes or fat, long chain or short chains of fatty acid. Okay, it can also translate into malnutrition. And electrolytes plays a big part in our health of the muscles, right? So if you have electrolyte imbalance, you may have a systematic muscle spasm throughout the whole body. So when you have this unknown spasm everywhere, all right, and with we call it, when we do assessment, we find that your colon are very sluggish and very restricted. Yeah, that could be one of the cause that the electrolyte is imbalanced. Maybe some people can do a medical checkup to find out the result from the blood test, but we can find out from the functions of the colon.
Yep.
Okay, and then for some people, they also might experience the non-specific headaches and foggy mind. Yeah, for some symptoms. This is rare. I don't see a lot of this problem. But most people come with the colon dysfunction. They always exhibit low back pain. Yep. And knee pain, yeah, mostly low back pain, knee pain, and sciatic sacroiliac joint also. Very tight sacroiliac joint when we do the sacral pull, when we do the sacral test. Okay, that would be most common.
Yeah,
and then
true.
We also want to talk a little bit on the why I see most of this in the Asian lady, because colon, like many other organs in our body, every organ have different emotions, that we express emotion through different organs. So for the liver, it's always anger. For the gallbladder is always a daily stress. Okay, stomach is also social self and also anger as well. When the liver cannot take it, you always push the stomach, and stomach and duodenum. Colon are always related to more feminine side. Feminine is like a female who are we love the family so much, care for the family so much. Everything is about the family. Everything is about being loved or wants to be loved, but love everyone. Okay, now these people always end up with a lot of spasm in the colon. I always see an elderly lady who has problem in the small intestine and colon. And when I ask them about how they look after their family, they always say that, okay, family is their everything.
So they are very
sometimes, yeah. Yes. As a visual manipulation therapist, right? Not only that we help to solve them with the structural problem, blah blah, and we have to help them with some maintenance, like emotional release, and tell them how to prevent relapse of the situations. This is our key role, like wellness. It's very important.
I mean, so we have this called biopsychosocial model. Okay, we call it BPS, where biological, psychological, and also socially as well. So it's very important for us to not just fit you as a person and also your structures, okay, but also from psychological and also the social well-being as well, because it's very important. If let's say we don't, just like right now, okay, if let's say just imagine staying alone and you don't see your friend for maybe 1 week, it may actually cause you some stress, as in like social stress, because you're not the one, and it may cause you some issue towards your body, which you may not feel it now, okay, like we were saying, it's accumulating, okay, and when that's for the long time of period, if we are not seeing anyone, not talking to anyone, then of course it will cause you all this stress to your body, and your body will take all these emotions, and eventually it will cause all like knee pain, back pain. Then we thought it's actually coming from the musculoskeletal side, but we didn't think about organs.
Yeah. It's really true. And then we have one friend here who asked me about any experience of VM helping with night cramp. Oh, I do, because this remind me of one middle-aged Chinese man, very Chinese. So he was introduced to see me. Initially, he wanted to try one of my machine, very expensive machine for his cramp, for his pain. Then, as usual, I always do VM assessment, and I told him, no, this machine is not good for you. So it's very expensive, but it's not going to help you elevate your pain, right? So then the listening was to the sigmoid, was to the sigmoid, with a very tight sigmoid compressing on the obturator nerve, and I free the sigmoid together with the obturator foramen, free up everything under the left pelvis. The technique was very light, okay, so very light. And this Chinese man was not expecting this. I know that he's not very impressed.
Okay.
But what to do, right? This is our technique. We are not going to give you pain. We are not going to crush your muscles to help you release the pain, because this is about nerve, right? This is about the organs, and we are releasing the obturator foramen to free up the obturator nerve that causes spasm. So luckily, this guy went home, and that night, he didn't suffer from any pain. And 1 week later, he came back telling me the story that he said that he was thinking that I am cheating him after the first sessions, all right, because the technique was so light, he doesn't feel anything. And that night, he told me that night onwards, he doesn't need to take Acosia to sleep, because every night he has to take Acosia to relieve the pain to go to bed. Yeah. So that is one case. But in Chinese, he was, he told me like he's a sanguan. Sanguan is like you are a cheater, like you are like and it's a Mandarin, like how I don't know. Yes. I'm so glad that he feel relief after one sessions. So if not, then my name will be quite bad. So that is a struggle with visual manipulation therapists like us, who are very new, because they are very niche. So the mentality of the general public is that no pain, no gain. All the muscle treatment and everything treatment has to be painful. Has to be strong. You must exhibit strength to kill the pain. But we are not. Our Jean-Pierre always say, less is more. Right? You must be gentle enough not to create the nociceptor, not to irritate the body.
Yeah, that's true. And then there's a question.
How do you determine spasm on the colon? All right, we are checking the motility. All right, checking the motility. We are checking the gliding. We are I can't tell you how we feel.
It's very hard.
It's very hard. You have to come to the class for to share so that we can share with you. In fact, when I first joined the VM1, I feel nothing. My hand was like a rock, like it was down there, nothing under my hand. All right, it took me about 9 courses, right, to start feeling. No. I mean, at the 4th, after VM4, I was able to feel some more already. So it's like after each lesson, after each training, your hands gets better and better. It's just like a wine taster, like how Pierre say, right? You can feel the difference of the wine from different yard, but it takes with a lot of training and experience.
That's true. Even the first was doing, I was like, okay, what am I feeling? Whether. So I mean, it's very hard to tell people or to describe to people. How do we actually detect or feel?
But it's really very scientific.
Yes, it's like palpation.
It's not about energy. Nothing about energy.
Yes. So so I mean the NHK rehab was saying based on the experience.
It is based on the training. So in every VM class, the teacher will guide us how to do palpations. We have to know where is the organs, and the teacher will tell you, all right, what is the sensation that you have when you are touching the liver? What do you feel when you touch the stomach? Stomach is very airy. Okay, you can do percussions to find the funness of the stomach, and the gallbladder is different. If you find the nerve is more like buzzing. So this is the when you have to know the nerve, you have to come to the nerve class. So you must feel the buzzing sensation. And blood vessels are positive, right? So every organs have their own property. So like lung has more pressure. Pleural is very gliding. So you go to different layer, you will perceive a different kind of sensations under your head. Really, a lot of training has to be done, and we are touching every service. Every time when we are doing anything, we just touch. So for me, I'm a lymphatic therapist. I was trained how to feel for the lymph flow. So people who doesn't know are not trained to have this light hand and feel for the lymph flow. You won't know how it's experience and keep on practicing. We read every night, right? We practice every day. So we touch. So what we can say is that nothing is magic. Nothing is everything comes with experience. But to know the VM more, do join our VM class. Really, you will. My mind was blown away 4 years ago when I first signed up for the first class, and I can buy a condo with the money that I've invested in the courses. But I feel it very rewarding. Very rewarding.
Yeah, very worth it. It's a different approach from.
Yes.
Yeah, it's a different approach because we believe that by doing this technique, it can actually add on more values to our clients. Okay, besides from just a normal manual therapy like joint manipulations, myofascial release, dry needling, etc. Yeah, so that's my point of view. So
because your traditional, correct, your normal physio training teach you to look at the lesions from externally, right? The VM teach you how to look from internally, so it match. So sometimes when you have the knowledge on the joint mobilizations, some exercise, some fascia release externally, then you look internally and you match the dysfunction. You will have a better treatment protocol, and more effective and more long lasting for your client. That is what we always emphasize.
Yeah, that's true. Because
So,
when we really look into the anatomy and the physiology of it, then only I understand, oh, okay, sometimes it's because of all this, because there are some cases that I've been treating for so many sessions, and it's still, I wouldn't say it's very effective, okay? There are still that I need to work on it, keep working on it, and the patient is feeling better, and it came back, for some of my cases previously. And now I add on with my VM, of course the effects is I would say it's a bit more effective compared to last time, where I was just doing pure physiotherapy skill, okay? But now there's another thing add on, so yeah, so it's a match.
You still need to do the
yes.
No, muscular. All right. Yes.
That's true. I still have
because I've learned all the more way to go. It's a long journey. If for the therapists here who are start thinking like, should you start learning VM? I can guarantee you it's a long journey. It's not about 1 or 2 years. It's not about 1 or 2 courses. It's about many courses. And some of our teacher or teacher assistants, they repeat the same course for 4 times or 5 times with different instructor. So it's I can't recommend much because I'm still pursuing and still attending and repeating the class myself with a different teacher, and yes, it's quite good. But I do feel the satisfaction of helping the client, because I have one lady from Seremban. She has TMJ dysfunctions, and she see a lot of doctor for 2 years. She keep seeing the physio in the Seremban, and she can describe. The technique was very brutal. I do a lot of deep tissue massage, give her a lot of TENS machine for 2 years, no relief. All right, so I'm so glad when I see her. I just came back with a course, the cranial nerve manipulations. All right, so we do the listening, and it bring me down to the trigeminal nerve. And I approach the trigeminal nerve with some nose approach, And when I take away the cotton bud, Evan, you have experience.
I tried it.
I remove the cotton bud. She can tell me the TMJ tension here melts immediately. Just 1 session, and she's not back. She said that she's fine already, and no recurrent. That was 2 years ago.
I mean, for when you were doing it on me, because one of my nose, my left side is a bit stuck, as in I have sinusitis. So whenever I breathe, I can breathe easily on my right side, but not really on my left. So after the session with you that day, on my left side, that the moment you pull it out, I was trying it. I was like,
the nerve, because the medical nerve that irritate the sinus. So
totally now.
I will recommend like the physio, if in this Instagram group, if you are interested to find out more, me and Alvin are happy to share. We can, after the MCO, we may even work on you and let you experience what is the VM, and it is just sharing. Yes.
Yeah, that's true. Well, okay. I think we are slightly a little bit out of topic.
Okay, leave out. So, in fact, we are done with the colon already.
Colons, that's
we are done with colon. So tomorrow our topic will be the pericardium. Pericardium. We are not talking about the heart itself, but we are talking more on the pericardium and the lung, and how it affects and restricts your cervical. And not only cervical, because pericardium sits on the diaphragm. It might be also the thorax. The lung and the thorax. It's more like thorax.
So schedule on the Instagram.
We have one friend here, Carolina, osteopath. Yes. So what we are doing also consider one of the osteopath. So hello, Carolina. Hopefully enjoy us, but we are ending soon. Okay. We'll see you guys tomorrow at
Tomorrow,
the same time. Yeah.
Yeah,
Okay.
just follow Evelyn at VL Therapy.
VL.
Yeah.
Yes, I
And
always forget.
Instagram
All
as
right,
well.
we'll share this post again. All right, Alvin. For some who join at the end, then you can revisit the video.
Yep.
We'll do that. Thank
All
you,
right.
everyone. Thank you for joining. Bye. Bye.